The internet is full of bro science, fake knowledge, half information, or propaganda. Your quest of reliable, authentic health information ends here. So subscribe this channel and hit the bell icon, and you never have to go anywhere else ever again.
Hello everyone, Namaskar, Adab, Sat Sri Akal. How are you today? Today is World's International Women's Day, and women's health is more important. Yes, it is. And that's why we are starting a new series today, which is called Her Health, right? So her health is more important than his health. That's why we're going to talk about her health, right? So first problem which we will discuss today will be painful periods. Obviously, every single woman, every single girl, every single lady has to go through periods, and once in a while, at least, sometimes they have painful periods. So why do they have these menstrual cramps, menstrual pain? This is also called dysmenorrhea in medical language. So we're going to talk about this problem today in very details. Let's start. So what are these pains, right? What are menstrual pains? Number one, menstrual pain are pain which is having during the menstrual period cycle, and this is not exactly a premenstrual syndrome. Premenstrual syndrome is different, and this pain, which can be throbbing or cramping pain in the lower abdomen, and you can also have other symptoms like low back pain, you can have nausea, diarrhea, headaches, right? All these things can happen along with the pain, but there is pain, right? And obviously in premenstrual syndrome it's a little different, because in premenstrual syndrome you will have weight gain, bloating, irritability and fatigue, which is not there in menstrual pains, right? And premenstrual syndrome starts 1 to 2 weeks before your period starts, and menstrual pain will start after your period starts, right? So the big question here is, what causes these pains, obviously, right? So for that we need to understand that there are two types of menstrual cramps, or in medical language we call dysmenorrhea, which is primary and secondary. Primary means which is caused not because of something else, it is because of something inside the uterus, something inside there, and primary is most common, right? It is the most common type, and it is not obviously. Then the cause is usually because of hormones. It is because of too much prostaglandins. Basically, prostaglandin is the main hormone, main chemical that your uterus makes, and this chemical makes the muscles of the uterus tighten, contract and then relax, right? So this causes the cramps. So prostaglandins, too much prostaglandins causes the cramps, right? This pain can start, primary dysmenorrhea, primary pain, period pain can start a day or two, just a day or two before your period, not a week back, right? And it can last for a few days, although in some cases it can last longer also, but then it cannot last much longer as compared to other pains. And usually what happens, when you start having periods first, when you are younger, you usually, when you begin to have your period, then you can have these kind of pains. But as you grow older, as you have more and more periods, then pain becomes less and less, right? Obviously. And the pain can also get better after you have given birth, right? After you have had a delivery, right? Then other type of pain is secondary amenorrhea, secondary dysmenorrhea, right? Dysmenorrhea means menstrual cramp. Secondary means which is caused because of some other condition that affects your uterus or your other reproductive organs. So other something like endometriosis or some uterine fibroids. So something is there which is causing pains, which is causing problems, right? That is secondary problem. And mostly these kind of pains will get worse over time. So if it is secondary, it will not get less and less over time, or after periods, or after delivery, it will get worse, right? And it can also begin just like that before your periods start and continue after your periods. So what can you do? So what should you do basically? So in order to help you yourself, you can actually try a few tips or tricks, right? First is to use a heating pad. You can use a heating pad or hot water bottle, which you can keep on your lower abdomen. Heating pad or hot warm on your lower abdomen, that can give you relief, because the heat basically relaxes the muscles, right? That you can do. Other thing you can do is you can get some little bit of exercise during that time. Take a hot bath, or you can do some relaxation exercise techniques like yoga or meditation, right? These are the basics. Then you might end up needing an over-the-counter painkiller. You can take a painkiller like non-steroidal anti-inflammatory medicines like paracetamol, brufen, ibuprofen, naproxen, etc., or acetaminophen, what you call it, right? Besides these pain relievers, besides relieving the pain, these non-steroidal anti-inflammatory drugs can also reduce the prostaglandins that your uterus is making. Therefore, they will actually decrease your pain further, right? And help you relax. This is important. But you can only take NSAIDs when you have symptoms, right? Don't start taking them before you having any symptoms. So you can only and you should not take if you have any ulcers or any stomach problems or any liver disease or any other problem, right? You should always consult a doctor before taking painkillers if you have these kind of or any major medical disease. And you should not take them if you are allergic to aspirin, if you have low platelet count, bleeding tendencies, etc. Heart disease, you have to talk to your doctor first, right? Then after this, what tests, right, medical help can you need? I mean, what tests or medical checkup do you need to go to a doctor? When do you need to go to a doctor? That is also very important, right? And in some cases, one more thing I need to tell you, in some cases, if you actually have a habit of smoking or alcohol, yes, you can have, or not having enough rest, then that can increase your problems. So you have to make sure that you are resting well, you're not smoking or not taking too much alcohol regularly. That is very bad for you. Smoking is absolutely bad for everyone, right? Then if your cramps are getting worse, if painkillers are not effective, if you're over 25 and have a severe cramp for the first time, and if you have a fever along with your cramp, if you have pain which when you are not getting your periods, right, if you have pain without periods, then you should go to a doctor for evaluation. And and what we do, we diagnose your pain on the basis of health checkups, medical history, and then ultrasound is done. Ultrasound or imaging test is done to see your uterus and other things. We can see what is wrong, and some idea can be taken out to find some fibroid or secondary dysmenorrhea, or you might need a laparoscopy, or maybe some other tests might be needed according to your case, right? And if there is actually some problem, so like secondary, there is a treatment. For primary dysmenorrhea, primary menstrual cramps don't need any treatment, right? You just need to do what I said in the first, just relax, take care of your health, keep a warm this thing, etc., etc. That will take care. And you can actually do some more things. You can take birth control pills, right, and you can use some patches, IUDs, rings. All these things are hormonal balancing. They actually balance your hormones and actually help you in avoiding future pains for primary menstrual cramps, right? And obviously painkillers, pain relievers are there. And secondary menstrual cramps, secondary dysmenorrhea, treatment will depend upon the reason. If you have, say, fibroid, surgery might be needed. If you have endometriosis, medicines can do, etc., etc. If there is an infection, then obviously antibiotics will be needed. So it will depend upon the reason, right? Pelvic inflammatory disease, etc., etc. There can be many reasons for secondary dysmenorrhea. So this is the basic why you have have pain, what you can do, when you need to go to a doctor, etc., etc., etc. So happy Women's Day. Make sure to share this video. This video will also come in Hindi में भी आएगा ये video. Do not worry and take care of yourself, right? Stay connected, stay healthy, and happy Women's Day once again.